Okay. Hello, everyone. Welcome to today's VMACS. Just a quick reminder of the ground rules before we start today. So again, everyone's audio and video is muted, and your video will always stay muted, and the audio you have to unmute yourself, and you can only do so later when we have the live Q&A. So in the beginning, you can ask clarification questions using the Q&A chat window, but live questions will be later. Before we start with today's presentation, we have Katja Mann here from the VMACS Junior team to update us on their seminar series this summer. Katja?
Yeah, thanks. So let me first of all invite you all to the seminar series. So we'll be starting on July 2nd. We put together the program now. There will be 10 sessions altogether throughout the month of July, last one in August. They will be on Tuesdays and Thursdays at the usual time. And you find the program already on the VMACS website. So let me also thank all the applicants. We got a lot of applications, so there were more than 200 actually, and there were very many extremely good ones among them. So we really had a hard choice deciding, but I think we put together a great program, and we look forward to the seminar series, and we look forward to seeing you there.
Great, thank you, Katja. Right, as you said, you can just click on in the chat. There's a link, and there you see the upcoming presentation of VMACS Junior. Today we have one of our own, Kurt Mitman, presenting, and his co-authors are also here: Mark Bognanni, Doug Hanley, and Daniel Kolliner, and they will talk about economic activity and COVID-19 transmission. Kurt, you have 60 minutes, and afterwards 30 minutes Q&A.
Okay, well, thanks a lot to my fellow co-organizers for giving us the opportunity to present this. Looking forward to getting all of your feedback on it. And Mark, Doug, and Danny are there to answer your questions during the first 60 minutes if you have them. Just a quick disclaimer, because Mark works for the Federal Reserve System, that the authors, the views stated in this talk are ours alone and do not represent those of the Federal Reserve Bank of Cleveland, nor of the Board of Governors of the Federal Reserve System. Okay, so with that out of the way, let's jump into what we're trying to do in this paper. So essentially what we want to do is we want to estimate what we're going to call an economic epidemiological model of the COVID-19 pandemic. And I guess kind of the key thing that we want is why we're going to say that it's economic epidemiological is that we're going to allow for feedback between economic activity and the infection rate. And what we're going to do is we're going to estimate this model at the county level in the US. So we're going to kind of think of it at a relatively granular level. And what we're going to do then is we want to study the role of different interventions that have taken place. So so-called non-pharmaceutical interventions, or NPIs, things like stay-at-home orders, school closures. So things that are not vaccines, treatments, medical treatments, things that are non-pharmaceutical in that nature. Then we're going to take our estimated model. We want to simulate counterfactuals to think about forecasts going forward, think about different policy experiments of kind of what policies could be taken going forwards, and then also some what-if scenarios to think about, what if we had reacted differently in the past, how things might have looked in terms of that evolution. And then we're going to calculate some optimal policy rules, is what I'll call them, and I'll be clear kind of exactly what that means later on. So just to give you an idea of what the framework that we're going to use is that this is going to be related to what people have called the behavioral storm model. We like, maybe because of where we did our PhD, we prefer the term economic to behavioral because of maybe some connotations that would have. But the idea is that we're going to start off with a basic SAIRD model. And what we want to do is we want to add in two-way interaction between economic activity and the spread of the virus. We also, and I'll be very clear kind of what I mean by economic activity, and we also want to study the connection between economic activity and economic output. So those two things will be separate concepts. And we also want to add in a spatial component for the fact that the virus can spread across locations, so that it's not just concentrated kind of as a closed county. We'll start off by characterizing some of the properties of this model theoretically, to kind of talk about the different regimes that it admits. Then, to bring the model to the data for, what we think is, our attempt at a serious estimation, we're going to add, some more COVID-specific features, things like asymptotic cases, deaths, and other features that we think describe the policy environment and the epidemiological environment that we've seen over the last several months. We're going to estimate this extended model via maximum likelihood, and then we're going to go ahead with our counterfactuals. Okay, the point of this slide is really to tell you where we think we fit in to what's been done. So this is kind of a little bit of a joke, in the sense that, there's been a huge explosion of literature, and like we could just, I could have to make this like 2-point font to put all the papers in. So sorry if we don't mention your paper. I put in papers in reverse alphabetical order, but kind of we think that the strands of the COVID literature have been what we're going to call theoretical, where there's been kind of minimal contact with the data, at least as it's evolved so far. And these kind of fall into like 4 classes. One, which I'll call like kind of core macro plus some epi component, where it's like we put in the epi, the SAIR model into kind of an otherwise kind of standard macro model. There's some papers that have looked at optimal policy kind of in SAIR models, some that have kind of looked at more of economic or behavioral SAIR models, and then finally macro models that just have kind of COVID shocks without explicitly modeling what's going on in epi. And these are more, we'll say, I think, kind of for thinking about ideas as opposed to having kind of serious contact with the data that we've seen. There's been another strand, which are more forecasting or empirical, which kind of are like pure forecasting models that just want to try to have the best forecast for, the number of deaths in the next week. And then more empirical papers that have tried to kind of look at, identifying the effects, of lockdowns, or kind of just doing more kind of qualitative, saying, looking in the data, how, describing how things have evolved. And so where we come in is I'm going to say that we're going to try to be quantitative, and then we're going to take what we think, is a micro-founded economic epidemiological model that we're going to try to estimate with, real-time data that we have coming in on economic and epidemiological variables. So we're going to kind of be in between these two, and we think that we have kind of something useful to say there. Okay, I'm gonna have one slide on the data, but this is kind of what we've been putting together over the last couple months. So we're gonna combine kind of 3 novel data sources, and then we're gonna have one data source that we built ourselves that's gonna essentially quantify the spread of the virus and the connection between the spread of the virus and economic activity. So at the county level, we're gonna have daily data on reported confirmed cases and deaths. That's gonna be from the New York Times. We're going to get hourly GPS location data from a large sample of about 45 million smartphones. This data is collected by a company called Safecraft, which has been very generously made the data available to researchers. And this records hourly visits to points of interest by these smartphones. And so a point of interest you can think about, it's a grocery store, it's a restaurant, it's a hospital, kind of anything that has a 6-digit NAICS code can be a POI in there. And so we have something like 3.5 million points of interest in that data. Then we also have data on hours in employment based on a worker firm match data set from Homebase, which again is generously given the data to researchers for free, which is a scheduling and time clock software provider. We can talk more about the representative of this data kind of later, but this is going to be mostly hourly workers, because that's basically what Homebase targets. But we have this daily data coming in, and then finally we construct a data set of non-pharmaceutical interventions that are implemented in the county level, kind of starting back from the beginning of March, and so we kind of do this across a wide variety of NPIs. We're going to aggregate all this data to daily frequency at the county level, and we're going to look at using data from January 1st through May 28th in the estimations we do. So this is just to give you a sense of the kind of the first look of what this data looks like. So in most of our outcomes from the model and from the data, we're going to have the four main data series. So in the upper left, we have daily cases per million. So this is confirmed cases. We're going to have daily deaths. Economic activity. So this is going to be, we're going to use kind of visits to these points of interest and economic activity synonymously. And so here we're going to have things normalized to 100 in the pre-period. So in January and February leading up to it. And economic output, we're going to think about output is equaling hours worked. So you think about just a linear production function. So economic output is going to be the equivalent of hours worked. So this kind of, the top ones we kind of all know, there was a dramatic increase in cases starting in the second half of March. The increase in deaths was a little bit lagged. At the same time, you can see that there's a pronounced drop in economic activity. Just in terms of what the lines are, the red line is the population weighted mean across locations. The dark blue line is the median across counties, and then the different blue lines are going to show you what the distribution is across counties. So one of the things is that there was a lot of heterogeneity in terms of kind of how bad the spread of the virus was. But we can see a relatively uniform drop in activity and an output across all of these areas. But there is big dispersion across locations, and you can see that the mean is very different from the median, and so the places like New York have a lot of population in a lot of cases that lead to that big discrepancy. In terms of the MPIs, this is just to give you a sense of what the rollout of two kind of very common MPIs were. So this is the black diamonds are going to be stay-at-home orders. So what we kind of classified as stay-at-home or New York on pause, things like that. And then the red dots are going to be MPIs that made restaurants be takeout or delivery only, so that they closed the dining room area. And so we can see kind of from the middle of March, kind of very quickly, almost all of restaurants, this is population weighted here on the left. So what percent of the population was subject to these MPIs? On the right is what percentage of counties were subject to these MPIs. So kind of, virtually 100% of the population, the restaurants were closed except for takeout. And again, by kind of April, almost, more than 90% of people were subject to stay-at-home orders. In terms of percentage of counties, again, some of the more sparsely populated counties didn't enact these orders, but you can see that there was, almost uniform adoption. And then kind of toward the end of April, we see that those were being reversed. I just want to show you again the activity and output graphs. So kind of the decline in economic activity output seems to coincide with when these MPIs are being implemented, but we can see that kind of by the end of May, a lot of these MPIs have been reversed, but we have had an increase in activity, but we haven't had that we haven't had the increase in activity to the same extent. And so we're going to argue that kind of from this, that there's a lot of endogenous behavior going on that above and beyond or replacing even what MPIs can do. Just to make that clear, here's kind of showing, I'm going to show you kind of activity in counties that didn't implement any MPIs kind of up through March 20th. So this is kind of looking at activity in the week, up to March 13th and the week after March 13th in counties where they didn't implement kind of any MPI. They didn't close schools, they didn't do anything. And so in the left panel here, again, this is kind of the activity in the week before March 13th. And we picked March 13th because March 14th was the National Declaration of Emergency. So we're going to kind of take that as a somewhat of a focal point for when it kind of reached the national consciousness. And then here's activity after that. So you can see, almost uniformly activity falls, below the 45-degree line. And this is kind of significant that things can fall 50 to 75%. This is just showing you that kind of in the whisker plots, they kind of by the Thursday and Friday after the National Declaration of Emergency, there's almost there's some outliers up here, but the vast majority of counties saw huge declines in economic activity, even when they didn't implement any type of non-pharmaceutical intervention. Okay, and you can see that there's going to be day of the week variation in activity because people tend not to go to work, and work's associated activity is going to be picked up in these things. One last picture from the data. This is again just to show that MPIs aren't necessarily always binding. So this is looking at when MPIs expire or when they're turned off, kind of what happens to visits or economic activity and what happens to hours worked. You can see obviously that there's a small jump here around the expiration of the MPI. The visits do go up, hours do jump up a little bit, but you can see that obviously there's massive pre-trends going on ahead of the expiration of MPIs, so that the MPI itself was binding for some people, but it wasn't massively binding that when all of a sudden you relax this order, you jump back up to normal activity. So people are still engaging in social distancing and restricting their activity even in the absence of policy. So these are basically, we want to be consistent with this data. So we want to understand policies, but we also understand how people are choosing to make these optimal decisions to reduce their activity in response to the spread of the virus. Okay. So now I want to talk about kind of the simple SAR model with economic agents. And this isn't the model that we're going to bring to the data, but this is a model where we can characterize some of the theoretical properties that are going to carry over to the extended model, but just to make kind of clear exactly what the trade-offs are going on before we go in to put in features that we kind of just need to match the data a bit better. Okay, so I'm going to go over this part relatively quickly because we've all seen these models by now. So, the basic model just has the 3 epidemiological states. We have susceptible, infected, and recovered. At any given time, you can be in one of those 3 states. And let's think about this in continuous time so that the flow rates are I dot, S dot, and R dot. The way that the transitions are going to work, so the susceptible agents are going to contract the virus at a rate n of t, which depends on time. So S dot is just going to be minus n times S. People move from susceptible to being infected. So as you flow out of S, you flow into N. And then people can recover at a rate delta. So you flow out of the infected state into the recovered state. And here we're going to assume that after you've had the virus, you have permanent immunity. Obviously, it's a big kind of open question that we don't know about. But for this talk, we're going to assume that people do get permanent immunity from having had the virus. Okay, so this is now where we're going to bring in economic choices. So kind of the economic or existential question, to Z or not to Z, is what we have. So the idea is that here you're going to have stochastic economic needs, which we're going to call Z. They're going to be distributed according to some CDF f of Z, where the support is going to be R plus. And so the idea is that if you have this economic need, you need to go out to some point of interest into the economy in order to satisfy it. And by taking an excursion, you expose yourself to risk of infection. Now, what's the cost of infection? So here we're assuming that agents are going to incur a cost of psi from contracting the virus. Here, things are linear, so you could just also assume that there was a cost of, here we have no death, so it's just kind of a cost from getting the infection. For the extended model, you could interpret this as what the cost of death from getting the virus is. So if you currently infected or if you've recovered, you don't have any infection risk. So anytime you have an economic need, you're going to take an excursion to go out and satisfy it because there's no trade-off for you. You can't incur the cost anymore, so you're going to go out and obtain the Z. Ooh, and there should be a line break there that's missing. But so the susceptibles are going to be the model's key economic decision makers. So there they know that if they go out and make an excursion, they're going to have some probability of getting infected, which is going to depend on some constant beta, which is going to basically describe how contagious the virus is in their economic environment and the number of infected people. And so the idea is that you're only going to go out to satisfy your economic need if the benefit is going to exceed the expected cost. So essentially, you're going to follow a cutoff rule, Z bar, that if your economic need is bigger than the expected cost of going out, then you'll go out and satisfy it. Otherwise, you'll just stay at home and forgo that. We could write down kind of a more micro-founded utility function that would kind of give this behavior, but we think this kind of makes clear exactly what the trade-offs are that are going to be going on in the model. So how does this generate an endogenous transmission rate? So the susceptibles are going to take excursion, at the rate at which they face needs that are above their threshold. So the activity measure of susceptibles is just going to be 1 minus the CDF evaluated at the cutoff, which again here is going to depend on the current level of infections and then the constants that are going to determine kind of how bad it is to get infected and how contagious it is. So the rate of transmission is just going to be pinned down by beta I and this activity. So this is we're going to get the feedback between economic activity and the epidemiological environment. And so here, more infections are going to lead to less activity, but also less activity leads to less infections. So this is, you shouldn't expect that we're going to see some kind of sync behavior. We're going to get something that looks more like a saddle because, as there are more infections, you cut down activity, but that makes there be less infections. So then, that pushes activity back up again so that you can think about getting something that's stable in the middle. This is just show diagrammatically, how things vary from SIR to the economic SIR. When you move from susceptible to infected, here the infection rate, is just purely pinned down by I, so it's just kind of purely deterministic. People aren't making any decisions, and you get the exponential growth. Here, where you have that the infection rate has this economic modification factor, which is going to depend also on I, because it's going to affect the cutoff that people take. So the people are going to endogenously respond and reduce activity as there are more infected people out in the environment. Okay, so again, remember I and R, they don't have any infection risk. They satisfy all of their Z needs. So the total activity is just going to be 1 minus the fraction of susceptibles that have draws that are below the threshold. And here you can see, again, just to differentiate this, that kind of total activity is going to be falling in the total number of infected people, just because all these constants are going to be positive, and the PDF is going to have positive mass. So infections reduce economic activity, even in the absence of any kind of policy. So how are we going to calculate output? So here, output is basically, we're going to integrate up all of the Z needs that are met. So for the susceptible people, we basically want to have the conditional expectation of Z, given that Z is above the threshold Z bar. That's going to be multiplied by the susceptibles. And then for the infected and recovered, they're going to satisfy those Z needs, which is just going to be the expected value of Z. So, you can think about this as being, the agents that restrain their activity, what their needs are times their probability of meeting them, plus the people consuming normally. Or you kind of rewrite this nicely that it's just normal output net of the foregone consumption of the susceptibles and kind of what the average value of that foregone consumption is. And so this is what we're going to line up with thinking about hours worked. So kind of we're going to estimate the relationship between activity and output, basically from the distribution of F over the Z draws. So kind of output in the economy is just the expected value of Z. And so this F is going to pin down what that relationship is. We're going to pick kind of a log normal formulation. And so we're going to have it be mean zero as normalization, and then we're going to estimate eventually this parameter for the variance. And this kind of just gives you a sense of kind of how activity and output are related. So, if sigma is very small, then essentially output and activity move 1 to 1, whereas you can get kind of a more convex relationship if you have higher variance. So it tells you at the cutoff, as activity falls, how much output are you losing. And this is why we're going to use essentially the two different series that kind of inform us what this trade-off, what this curvature is between going out in the environment and actual economic output. Okay, so this model is going to admit two regimes, which I'll talk about now. So there's going to be we've all kind of heard about or not. There's the baseline reproductive rate, which is just going to be pinned down by the beta, so how contagious the disease is, and the rate at which infected people are going to recover. So that's kind of just from parameters. Now in our model, we're going to have this effective reproductive rate, which is going to depend on economic behavior, which is going to be the activity of the susceptibles times R naught. So if you think about kind of at the beginning of an epidemic, when there's essentially no infected people, almost everyone is susceptible, then to first order, you're going to get that activity is just equal to 1, and you're going to get exponential growth. So this model at the beginning is going to look exactly like the SAIRD model, where people are not making any decisions, because if there's only one infected guy out of 300 million, you're not so worried, so you just behave as normal, and then we get the standard exponential growth. Now, as the infection rate goes up, what this model actually admits is something that we call kind of a slow burn regime, where we have almost like a pseudo steady state where the infection rate is approximately constant for potentially a long period of time. And basically, the way you can solve out where the infection rate is constant is just kind of looking from the transmission rate times the activity related to the activity of susceptibles. And so here you can kind of parameterize this by thinking about this is the activity of susceptibles, which depends on the cutoff, which relates to R naught. Now, if the virus is very infectious and if the cost of getting infected is very high, then this denominator gets very large, and kind of the Z bar term here drops out. And so we get that the cutoff is approximately the inverse CDF of 1 minus 1 over R naught. But then if you plug this back in for Z bar to get the activity of the susceptibles, you get the activity is essentially 1 over R naught. And remember, the effective replication rate is A times R naught, which means that our effective replication rate is 1, which means that on average, one person is going to infect one person. And so that you're going to get this regime where you have essentially a constant fraction of infected people and kind of a constant daily set of new infections. That's essentially just going to be pinned down by the parameters of the model. So this is kind of what I was talking about with the saddle, is that if infections fall lower, then you kind of compensate by taking more activity, so it kind of pushes you back to 1. And if infections are higher, then you reduce your activity to push R back to 1, and you kind of end up in this saddle where the effective replication rate is approximately 1, and given that with 1 you can take a long time to get to herd immunity, that this regime can last for a long time, which is why we call it a slow burn. So just this is SIR, ignore that, that's a typo. This is just again kind of to show you a phase diagram of to compare the basic SIR model to the one that we've written down. So here each dot kind of represents a week in time, and so this kind of is what we all know, that you have this exponential growth. At some point you reach the herd immunity threshold where then the replication rate falls below 1, and then you slowly get down to where the virus dies out, but you overshoot the herd immunity threshold because you have lots of active infections going on when this is happening, but it all is over relatively quickly. Now in the economic model, here I have shown you kind of 3 cases. The blue line is the one to look at first. So this is kind of is thinking about like what happens in this economic model when you start off with some measure of infected. Well, at the beginning, you still have this exponential growth regime where things are growing very quickly, but then you transition to this kind of what we call the slow burn, where things are approximately linear. Obviously, it's not exactly linear because eventually things are going to go down. But the blue line here is kind of taking the median counting in our estimation and rolling the model forward. Now here the dots are spaced 1 year apart. So if things were spaced 1 week apart, the epidemic is over relatively quickly. Here, kind of you're in this long slow burn for potentially a long time, because with a replication rate of 1, if you need to reach 50% of people being infected, it's just going to be very slow if only something like 0.1% of the population are currently actively infected. The green here shows you what happens if we just have the cost of infection. So if you kind of have the value of life, which is going to pin down kind of this rate of the slow burn. So then you can see that we get a bigger peak in terms of infections, and it kind of about halves the number of years it takes in order to reach herd immunity. Finally, the red shows what you could do, kind of achieve from a hard lockdown, where you kind of cut output to about 85%. Then here you don't get any overshooting, and kind of with the lockdown, it still takes a long time for the virus to go out, but you don't have this overshooting, and you can end things a bit earlier. But kind of when people are responding endogenously, you get these kind of very long regimes where the replication rate is approximately 1. Okay, so those are kind of the concepts, is that you get exponential followed by linear, and that's going to carry over into the model that we're going to bring to the data, and that what we're going to basically pin down is kind of what these regimes are going to look like in the US. So this is we're going to have a spatial component in our extended model. So the features that we're going to add in, again, the basic SIR model is 2 stylized. We know that we have asymptomatic people. We know that obviously lots of people, unfortunately, are dying as a result of the virus. So we're going to add in these 2 states. So with the asymptomatic, it's also sometimes these are called exposed. We're going to think about them as people that don't know that they have the disease yet. They can transition kind of to developing symptoms, or they can immediately become recovered. So these are kind of people that would they never knew they had it, and they now have some kind of immunity. And so lambda is going to be the rate at which they develop symptoms. Delta is still going to be the recovery rate for people that are symptomatic, and kappa is going to be the rate at which people die. And we're going to assume that to die, you have to have first developed symptoms, which we think is not very restrictive. Okay, we're going to allow for the possibility that people that have been exposed or that have symptoms can quarantine themselves, and these are we're going to estimate from the model. So this is essentially a small shortcut that we're going to take. What you may want to do is kind of think about the A's, not knowing whether they were A or S, and there being essentially a fixed point that you would need to solve for their activity. We're going to estimate kind of what the activity of people that are asymptomatic are, and it's essentially going to be thinking about like the past activity that's susceptible, so that it's going to look like that equilibrium. But again, it's to estimate the model at the county level, we're going to take a little bit of a shortcut there and estimate their activity. And then we'll also look at the activity for people that are infected. So the susceptibles, again, they're going to take an excursion now, which is going to depend on X. So it's going to depend on the amount of activity that the asymptomatic and the symptomatic are taking. And so now our endogenous infection rate is going to depend on the susceptibles activity and the activity of the other two states. Okay, in terms of policy, so policymakers in the model can impose MPIs like lockdown orders. And the way that we're going to think about a lockdown order is that it's going to be a minimum threshold for agents making excursion decisions. So it's like if your needs are below some Z bar, then you're not allowed to go out of your house. That's kind of the way that we're going to think about closing non-essential businesses. Is kind of your Z bar for that is low, so we're not going to let you out. Agents still obviously have their own private Z bar, which is based on their aversion to the infection. So this is in the sense in which that MPIs may or may not be binding, and that the Z bar that's going to matter for the decision they take is going to be the max of their private one and the one that's imposed by policymakers. So an MPI could be binding, it could be not. It could be binding sometimes and not other times, depending on how things are progressing. And so it's going to depend on essentially how strong the endogenous behavior is. And what we're going to do is we're going to let the data tell us how effective or how strong these MPIs were. So we're going to estimate the level of the MPIs that were prevailing in the data. We're also going to add in underreporting of cases. We know testing capacity was fairly limited at the beginning of the outbreak, and there's been kind of a secular increase in the number of tests that were performed over time. So then we're going to assume essentially that there's a time varying share of new infections are actually reported. So if N is the number of new infections at any given time, then epsilon times N is going to be the number of cases that get reported, which is what we're going to take the data. And we're just going to estimate kind of an exponential function here so that some fraction epsilon naught, some constant epsilon naught plus some decay here. And the idea is that, even if we had unlimited testing capacity, we may not measure, we may not kind of from the health system record all cases. A new one is going to basically pick up the speed at which testing capacity is increased over time. So how better able we are to actually catch the number of new infections that are out there. This is again a feature that is kind of very salient in the data that we need in order to match it for the estimation. Finally, we're going to add a spatial component, and basically we're assuming that people that are infected can move across locations, and that agents understand that if they go to the store, they may run into someone that lived in their county, or they may run into someone that fled New York City and is now in their county that is coming from a totally different infection environment. And so the idea here is that we kind of have this relatively simple that agents, with some probability alpha, which will estimate they run into someone that lives in the county where they live, and with the complementary probability, they'll run into people in proportion to their relative population of that county from the US. So, this is going to kind of pick up, these documented seeding events from areas like New York City that had high populations and high infections that spread out across time. This is also going to help us to match that, even in areas where there were very few infections to begin with, activity falls because people were afraid that, that kind of the virus was out there, and even though it may not be there right then, it could come from different locations. Okay. That's the building blocks of the model. So now we're going to bring the model to the data. So, essentially what we've done, like I said, we put together these 4 data sets. We're going to use daily data at, like I said, the US county level. We're going to use data on about 1,000 counties, just in order, for things not to be kind of complete measurement error. We're going to have a population minimum so that we, have a certain number of cases, and we also have the people show up in the activity and output data. So that's why we don't have the full set of counties, but this, these 1,000 counties account for, I think, over 90% of the US population. So, we're throwing away kind of areas that don't have a lot of exposure to the virus and don't have a lot of population. So essentially what we want to do is we want to match in the time series the number of new COVID-19 cases, and so this is going to correspond to that variable N reported. So it's going to take into account the fact that there's underreporting, which varies over time. Then we want to line up the new confirmed deaths. So we're going to look at the change in the deaths in the model. We want to match activity. So with that, we're going to line up with the SafeGraph point of interest visits. And then our measure of output, which is going to be integrating up across disease, we're going to match hours worked from the home-based data. Now we're going to, for the estimation we have today, we're going to estimate the effects of restaurants kind of going to takeout only and from stay-at-home orders. So essentially, there'll be an indicator flag if this is on in a county, and then kind of across counties in the time series, we'll estimate how strong these MPIs potentially were. We're working on a further estimation where we kind of add in the full set of MPIs, so school closures, personal services, kind of to put all of those in, and we can allow these things also to be kind of hierarchical. So it could be that there's one Z bar for restaurants, one Z bar for stay at home, but if you combine them, it may not be linear. So that we're working on in the current estimation that we're doing, but we have these two for today because, like you saw, those were kind of the most prevalent that went out there. Okay, so essentially we want we want to fit the model using information kind of from both the cross section and the time series. Now, one of the things about even the model we have now, it's still going to be deterministic given the parameters and the initial conditions and the sequence of policy. And so in order to be able to make probabilistic inference about the parameters, what we're going to have to assume is that there's measurement error across the four main data series that we have. So how are we going to build the likelihood function? So let's think about the vector theta as the free model parameters that we need to estimate. Now, for county I at time t, we're going to have kind of variable j that's going to be denoted by x. So this is going to be the four data series that we're going to use. And so we're going to have some big vector x, which is going to denote all the data that we're going to use for the estimation. So we're going to denote the kind of a series specific likelihood, so Lj, for those four data series, which is going to be proportional to this probability density function P of j, which is the probability essentially of the data given what the parameters are. So then the full likelihood function is just going to be the product across locations and time and across these four data series of the series specific likelihood functions. And so what we want to do is essentially we're going to estimate the parameters by maximizing the likelihood function. For the economic variables, we're going to assume that these are going to be there's going to be additive Gaussian measurement errors around the model prediction. So this kind of makes sense given the assumptions that we had kind of put on with the distribution of F, and these are continuous variables in terms of activity and output that we have. And so we're going to put in those innovations, and again we're going to weight the data relative to county populations in order to do the estimation, and we're going to assume that these innovations are independent across time, location, and the series, and so that the likelihood for the economic series is just going to be proportional to it's going to be normal, and it's going to depend on the model outputs given the parameters and the estimated values for the error variances, taking into account the weights across counties. For the epidemiological variables, now these are integer things that are that are discrete. They're bounded below by 0, and so in the model, we've kind of taken a continuous time model with the law of large numbers and post-time shocks. So there, we're kind of thinking more in terms of fractions of populations. So the way that we're going to map the model to the data is in terms of an expected count. So we're going to think about that take the population fractions of new infections and death, multiplied by the population, and that will be the expected number of counts. So what we can do is we can model these counts as Poisson, and then the Poisson parameter is what's going to be kind of pinned down by what comes out of the model from the predicted count. So here now, like for the epidemiological variables, likelihood is going to be Poisson. Again, we're going to construct this kind of two predicted values, one for cases and one for deaths. So the RT is essentially just going to show is taking into account the underreporting. So we're going to allow for, again, the underreporting kind of directly in the estimation. Just a little, it should be upsilon t, but it's my fault for not informing my co-author of what notation I used, but that the R should be the epsilon that we talked about before for the underreporting. And deaths, we're going to assume that essentially there's no underreporting of deaths. But here again, we're going to multiply the kind of the death rates by the county population in order to get the counts. Okay, so that's basically what we're going to do, and that's why essentially the kind of the true I in the model could be very different from what the number of cases that we see that were reported in the data are. Okay, so the parameters that we estimated, we're going to have these epidemiological state transition parameters. Those are going to be common. We're going to assume the virus is the same across space. We're going to allow that the infection rate per excursion, so the beta and the psi, the cost of infection, we're going to allow those to be kind of county specific. So they'll be invariant over time, but we allow them to be county specific. So the beta kind of makes sense that the very dense areas may have higher betas, that the disease just travels faster there. The psi we think is going to capture also some demographic features that areas that have higher number of people that have comorbidities, they may behave as if the cost of infection is higher because it could be their probability of death is actually higher. So it's kind of a reduced form way of capturing the fact that people may be differentially afraid across locations. Like I said, we're going to estimate these quarantine rates, the variance of the economic needs, the underreporting parameters, and we'll estimate the MPIs and social distancing orders. So that's what we're going to throw into the estimation. Okay, so how do we do in terms of fit? So here I'm going back to the data I showed you at the beginning. So the blue again is going to be data. So this is going to be the data mean and then the data distribution, and the red is going to be the mean that comes out of the model. Obviously, there's like day of week effects that are just due to the fact that less deaths get reported on Saturdays and Sundays because I guess they just get reported less. So that we're not going to say anything about because that we don't have kind of day of week notion in terms of reporting. So that's why we're not going to ever match those kind of high frequency wiggles. But we think we do a good job of kind of matching the increase in cases and then also the daily deaths and the evolution over time. In terms of economic activity, for economic activity, because we do want to take into account day of the week effects. So here we're allowing the fact that your Z draws can be different on the weekend than during the weekday. Because again, we're thinking about kind of needs associated with going to work. And so that's why here we're able to match the fact that we see these day of week effects in terms of output. Because here we kind of want to get a sense of kind of total output. And so if hours worked and activity is varying differently on the weekends, that we want to try to capture, because that will then feed into kind of the overall spread of how people are going out. And there's no other way that you can get that on Saturday and Sunday people go to work less and work less without kind of putting in weekend specific draws from the Z. So that's something that we also add. But you can see here we do a good job of getting the drop in activity, and that we start getting a slow recovery kind of from the middle of April onwards. This is kind of putting those four together. Again, we're able to match again that the decrease in economic activity kind of takes place at the same time as the increase in the spread of the virus, so that the model is able to capture kind of. I'll show you kind of how much of this is going to be coming from MPIs and how much of this is just from the endogenous behavior of individuals. But the model is able to capture this kind of two-way interplay between economic activity and the spread of the virus. And remember, by May, lots of MPIs had expired, and the model is saying that people are still kind of afraid, kind of consistent with the data, even when they're not being told that they have to stay at home. Okay, this is just showing kind of the fit, kind of the difference between model and data across the distribution, and the mean. So obviously, we maximized likelihood. We didn't fit the data perfectly, but we do, we think a very good job kind of at the mean, and the distribution doesn't look too bad in terms of the residuals. Now, for the epi variables, this is for the economic activity. We're off a little bit in terms of the exact kind of drop in activity in March. So kind of getting that exact timing has proven to be a bit hard, but kind of after kind of that initial event, we were pretty good in terms of the activity and output trade-offs. This is showing you if you accumulate things up, again, if you kind of match the daily, you're also going to match the cumulative. So we kind of match the cumulative path of the epidemiological environment. And this is just kind of showing if you smooth activity, so kind of take out those day of week effects, that again, we do a good job of kind of matching the decline and the fact that things are starting to reverse at the end. Okay, so this is just to show that, you know, our estimation we think was pretty successful. This is also to show you now, instead of the means are the same, but I've now plotted the distribution across model counties as opposed to across data counties. So again, we get within the model that there's kind of this big dispersion in the extent of the spread of the virus across locations. And similarly for activity and output, again, we get kind of big dispersion across locations, and we get again this kind of deviation between the mean and the median. Okay, so now I want to start talking about kind of some of the things we learned from the estimation about policy. So, you know, like I said, we estimated the two MPIs, the stay-at-home order and the restaurants being open for takeout only. So what this is saying is kind of looking at what fraction of total counties was activity being constrained by one of the MPI policies. So this is kind of a combination of, you know, was there an MPI in your location? That probability multiplied by was the MPI binding. So, you know, if there were no MPIs, then this would all be zeros. So it's not like would an MPI have been binding if it had been in place. It's was there an MPI in place and was it binding? So you can see kind of in March, you know, the MPIs were actually binding in a lot of places, so that there were a lot of places where the virus hadn't really, the number of infected was still relatively low. And so that those MPIs were binding, so activity was lower relative to what people would have done. But, you know, if you remember by this time, you know, for the stay-at-home and the restaurant orders, you know, almost 100% of the population was subject to these MPIs. And what our model is telling us is that actually, you know, only about 20% of MPIs were actually binding in those counties at that time. And then kind of as, you know, then as we get into May and April, you know, this is kind of a mixture of MPIs not being binding and also MPIs expiring, where it starts to go down. So they kind of by the end of May, there was only about 10% of counties that still had MPIs in place that were binding in terms of activity. So this is kind of essentially, you know, if you think that one way to interpret this is that the MPIs were maybe not very strong, or kind of not strong enough to reduce activity kind of even more than they had, than what people were willing to do on their own. This is just to give you a sense of what the kind of, in the estimation, what the effective reproductive rates look like kind of now, kind of or like at the end of this sample, so at the end of May, so that there, you know, there's some areas where we still have kind of growing cases, and then we have, you know, other areas where cases seem to be falling, but, you know, we get the kind of the mode here is where we have an effective reproductive rate of about 1. So this kind of shows what things look like. So there's still some areas where, you know, as we know, kind of that the spread of the virus is still increasing quite a bit. Okay, now in the last 10 minutes or so, let me talk about some of the policy experiments that we've done for this. So the first thing that we decided to do was kind of think about, well, what if at the end, you know, we estimated this model up through May 28th. What if at the, you know, after that, all MPIs were relaxed and we just kind of rolled the model forward for a year to see what happens? So one of the things that we get is we do get an increase in cases. I mean, it's kind of in the mean, it's kind of hard to see. You can see in the distribution, there's some areas that see kind of dramatic increase in daily cases in response to the end. So we were, not that we were happy to see that cases are increasing in the United States, but at least that gave us some, you know, confidence that the out of sample fit of the model is not so crazy. But at the same time, we do see the model predicts that deaths continue to fall, which is also consistent, like, with what we've seen so far, kind of for the first, you know, 3 clicks of the month of June here. And yet economic activity starts to recover, but again, economic activity and economic output still stay depressed, you know, for a very long time. So if even by kind of the end of next year, we still get that kind of hours worked at these firms would only be about 80% of what it was before. So the economic activity stays relatively low, and this is exactly where we kind of, you know, we've kind of, what the model says is that kind of by the end of this year, we've kind of reached the slow burn, you know, quasi-linear regime where things kind of just improve very slowly and daily deaths and daily cases are approximately constant. Here we do a kind of factual where we say, well, how would things have been different if all of the MPIs kind of in place at the end of May just stayed in place at the end of May as opposed to them all expiring? So kind of The true data is somewhere in between because MPIs are still being, not that they were all kind of relaxed at the end of May, but a lot of them are continuing to be relaxed over time. And so this kind of shows the differences. So kind of relaxing the MPIs has led to kind of some of these explosion of cases across different locations. So that kind of you get kind of by purposes, we have an extra kind of 100 daily cases per million in some of these areas because these MPIs have relaxed. But that has also led to an increase in economic activity and economic output. So that kind of the relaxation of the MPIs has been good for, well, has boosted kind of consumption or the disease that people are taking. Okay, this I won't spend too much time on, but if you want to know kind of how does this play out, well, it plays out until about 2032. Here you can see, in longer time horizon, you can see kind of the initial spike of cases that we get from, this is if we kind of end all the lockdowns in June, and then kind of what it takes to get to this low regime. But, absent any kind of cure or vaccine, the model predicts that it takes a very long time in order for output and activity to recover, because, it just takes a long time when R is approximately 1 in order to reach herd immunity. But now, I want to take that passage with a little bit of grain of salt because, so far we've assumed, this model is kind of continuous. We've assumed that we have Poisson shocks and some law of large numbers holding. And so, you have this funny outcome. There's always some measure of people that are infected forever. So, the virus can never be eradicated until you reach kind of the herd immunity threshold, which is just pinned down by the parameters R0. So here we're going to implement a version of the model where if the total number of people that have the virus, so the asymptomatic and the symptomatic, then that can go to 0 when it falls below some threshold. So for today, we're going to think about if there's less than 1 case per million people. So the median county has like 20,000 people, so that means that if the model says that 0.02 people have it, then it just goes to 0. And then it's literally 0. So then the virus stops spreading in that county. Now, there could be, your dog could have it. People could come from a place where it's not 0. It's not clear that this eradication, could necessarily be achieved in equilibrium, but it does seem like there's some other parts of the world where, cases have essentially gone to 0. So we want to think about how things look where we have kind of this case where we don't, we're not beholden to Poisson and law of large numbers. So what we're going to do now is we're going to kind of look at if we have this eradication zone where cases can actually go to 0, we want to solve essentially for the optimal time varying policy. And here I want to be clear what we mean by optimal policy. So here we're essentially allowing Z bar to depend on the current level of infections. So that's essentially the rule that Z bar, it can depend on the current number of infected people. And where the planner understands the kind of the threshold for the eradication zone, the other and but that the Z bar will be kind of the policy will be the same across locations. The effective value will be different depending on what the current infection rate is. And I want to say one thing here also about in terms of the planner's objective function is that the planner is taking the revealed preference value or the revealed preference cost of the infection in terms of its optimization. So, we estimate the psi based on people's choices. So how bad it is for people to get infected or to die as a result of it is based on them making these trade-offs, which we've estimated. So it's not going to equal, what the EPA says the statistical value of life is, where the planner here we're going to take is going to have the same as the revealed preference. So to the extent that people are also behaving altruistically in their activity choices, this would be an overestimate of, if the planner actually had kind of its true value of life. Just to be clear, kind of exactly what, I haven't written the objective function, but kind of what exactly it is that the planner is optimizing here in terms of what the trade-off is in terms of people getting infected. So here, essentially, when you have this eradication zone, kind of what it calls for is a very, I think it was sort of a pretty hard lockdown for about a month. So something like 20% down to 20% of economic activity, and then a slow, then basically once the cases start to go to 0, then you can have this resumption, relaxation of the policy where activity and output then can go back to normal, and that you have the virus kind of essentially eradicated by default. But this, it says that you kind of need hours work to fall more than 60%, and you need activity to be quite a bit stronger than what we've estimated from what we've seen in the data. So that, kind of the MPIs that we implemented are kind of relatively too weak to kind of what this optimal policy would say you need to do in order to snuff out the virus. This is kind of to show you that kind of perverse effect that I was talking about, that if you have no eradication zone, you can have a very strong lockdown for a short period of time, and you almost get to zero, but there's epsilon guys out there, and then once you release, then there's epsilon guys, you hit the exponential regime for a bit, and then you go back to linear, then it kind of all comes back. So it's kind of just one word of caution about taking the model a little bit too, we think maybe too literally with the Poisson shocks and the law of large numbers, is that you never actually go to zero except at t equals infinity. Okay, this is to show you what that, for this simulation, kind of what you could have super harsh activity in this model without the eradication zone, but then it's still going to come back even after a few months. Okay, this was, oh, sorry. This is again showing kind of what the, I'm sorry, that those slides were duplicate. They should not have been in there. That's kind of one thing. So, it looks like the kind of the MPIs that were implemented in terms of our estimated effectiveness were kind of not enough to really kind of take the virus out. They reduced activity, but they weren't kind of strict enough to push it down to where this thing could be eradicated. Okay, it's a question. This is kind of something that's been asked about. Should we have responded earlier to policy? So this is kind of showing if we just take all the MPIs and have them start 1 week earlier than they did in the data, kind of how effective would that have been? And so here, kind of by the end of May, in terms of kind of on average, that it's about kind of 75 deaths per million. So 75 people per million died as a result of the delay in activity, the delay in the lockdown. So, locking down early, even 1 week earlier can lead to lots of lives saved. So kind of acting quickly, given that you have things kind of growing exponentially at the beginning can be pay lots of dividends. Okay, this is, we did kind of another counterfactual where we say, if when a national state of emergency was declared on March 14th, we had kind of implemented the nationwide MPIs. So kind of all the two MPIs that we kind of estimated, the stay at home and the closing of restaurants. Imagine that we just turn both of those on in every county on March 14th and keep them on through the end of May. How would things look under that setup? I should have plotted this in differences, but you don't actually see kind of that much difference in terms of the cumulative deaths and the cumulative cases relative to what we had. So they kind of, this is for places like New York, this would only been a few days earlier. But what this kind of says is that, the MPIs, as implemented were maybe not super strong in terms of, I mean, obviously activity fell by a lot, but like in terms of relative strength to really curtail the spread of the virus, they weren't strong enough. Here's something if we did something stronger, so kind of MPIs that would reduce activity down to 30% of the pre-time period, and basically would take output down 60%. So hours worked would be 40% of what they were before. There you can see, kind of pushing things down from 60% to 40%, leads to huge dividends. So instead of something like 200 deaths per million people, we get down to something like 20. So that, we see this nonlinearity, and when you kind of push to more severe lockdowns, you can get much bigger gains in terms of lives saved. And we kind of, we think relating this to what we saw in Europe is that, our kind of armchair takes is that lockdowns in Europe were stricter than they were in the US, and that may explain why they have kind of some better outcomes today. One last figure I want to show before I conclude is just kind of showing, if we think about the Possbilities Frontier of kind of this trade-off between output and deaths, I'm going to show you this little movie, which is going to show kind of different time horizons, kind of what the different colors are going to show you kind of the severity of the lockdown, kind of what you're trading off in terms of output loss and additional deaths. So here you want to be at the origin. Origin means no people, no one dies and you don't lose any output. And one of the things that we get out of this model is that kind of depending on the time horizon, you get this inversion, so that this is with the eradication zone. So they kind of very strict lockdowns for a short period of time can then, you can eradicate the virus so that kind of over the longer horizon, you actually get, very small numbers of additional deaths and small kind of cumulative alpha loss over that period by kind of acting strongly. Whereas, if you just look at the short run gains, obviously being tough for 30 days, you lose a lot of output and you still have deaths. But if you kind of push very hard for a short period of time early on, over the course of a year, you can get much bigger gains. Okay, I am out of time. So just to kind of wrap up, we put together this model that we think can capture the interaction between economic activity and the spread of the virus. The theoretical implications that come out of the model is that we get, what looks like kind of basic SAIR, so this exponential regime at the beginning, followed by this kind of long period where we have an effective replication rate that's approximately 1, which we think, based on what we've seen so far, is a good representation actually of, we kind of didn't do this on purpose. It just kind of came out of the model that we wrote down, that it seems to fit very well with what we're seeing across countries in the data. And kind of the final, pondering point about policy is that, if we have this eradication zone, stronger lockdowns can lead to eradication, and that, in the on longer horizons, you don't really have a trade-off between output and lives lost, but you need, the lockdowns need to be relatively severe over short time horizons in order to eradicate the virus. So I think I'm out of time, so I will stop there.
Great. Thank you so much. Great presentation. And we also had a couple of questions in the Q&A that were more like not clarification questions, but longer questions. So if you want to ask these questions to Kurt and the co-authors live, just raise your hands. Everybody can raise their hand. Just click on the participant button and raise your hand if you have a question. And I would also ask the Q&A chat questions to be asked again, because some are not answered and some are very long, so we can discuss them all together. So just give the audience a bit of time. Let me just shoot off with a little question, Kurt. So you had that fraction alpha, the probability that I meet someone else from a different state, right? But this is constant over time, right? It doesn't depend on how much I go out and whether I reduce my state travel or so. Right? Is that correct? Or could you also identify this, that people, they travel way less across states, and that this is an important route of transmission that's shut down over time?
Yeah, so the alpha is constant across time. So that's something that we could allow to be time varying. So we have data on that from SafeGraph. So like if you visit, the McDonald's in New York City, we know, on average where your cell phone was sleeping at night. So whether, it was sleeping in New York City or whether it was sleeping in, Boston. So that's something that we could try to actually discipline with the data. We just haven't done that yet. So we could look at kind of, we have these, they track a lot of information with the smartphone. So we have kind of these measures of what the spread is. So that we could do better in terms of, we have another estimation where we kind of do it based on distance, but you're right that we've kind of taken this as a, kind of a simple way of getting, the problem is that it's difficult to places that have no infections in March 14th, like how do they get infections? So this is a way to kind of seed it to other locations.
Okay, so let's see. I mean, there's also a couple of questions from the panelists. Laura, do you want to shoot off with your first question, and then we go to other people?
Sure. Hi. So I thought what you were talking about with the value of statistical life was really interesting. I think it makes a lot of sense to actually have an estimate of that number that's consistent with the model, and then have the planner use it. So I actually was just curious what the magnitudes of that were relative to ones that people normally use that come from outside of the model. And then the second thing I wanted to ask about, which I think is related to Andy Glover's question in the chat window, is I guess you had a different estimate for the beta and the phi for each county. Is that right?
Yes. Yeah.
So I was curious if there's, if you correlate that with other characteristics at the county level that are not captured by economic activity or whatever, which is what's used to estimate those here, whether there's something that's driving those. And Andy gave some examples, like the age of the population or maybe political affiliation or something, whatever. It would just be interesting to see the distribution of those things.
Yeah, so I think Doug and Mark, you can feel free to answer too. I mean, I don't know if we put it, maybe we put it in the paper. So the beta does correlate with population density. So that for sure, areas with, I mean, it's not like it's one, but certainly areas that have higher population densities end up having higher betas on average. So that we thought, you know, made sense, and we were happy with. In terms of size, we've downloaded we have the data on counties kind of age distributions and comorbidities. So that was kind of the next thing we wanted to look at, was to try to see if those correlate with kind of some measure of kind of the cost of infection based on those things, but we haven't kind of made those scatter plots yet. Then on the value statistical life, we were just trying to calculate this. So we think that our number ends up being something about twice as high as the EPA number. Again, it depends a little bit on how you want to discount the future, but that's so we're high in terms of that number relative to kind of some of the numbers that other people have used in papers. So our planner is kind of being a bit more cautious, I guess, with people's lives than if you just put in the, I guess, kind of 11 years of GDP per capita.
Well, thanks.
I think, did I answer it all, or I don't know, Doug or Mark, if you want to say anything? Okay.
Great. So just again to the audience, so if you have questions, please raise your hand using the participant button, and also these people who have asked questions using the Q&A, we can discuss them again all together. So until then, I will give to Morten, who also had a question.
Yeah, no, so great presentation. Yeah, so I missed a little bit how you dealt with the asymptomatic cases. Could you go back and just to remind me?
To what again? To
the asymptomatic. Yeah, there was the link between the set variable and the risk you are facing out there. That's what I was missing.
Yeah, so I guess this is probably maybe the equation that you wanted.
Yeah, because I'm just wondering about how, if you think about this as decision problem, how the susceptibles now can sort of condition on the number of asymptomatic cases implicitly.
So I'll tell you what so I guess that's, I guess from the point of view of the model, kind of once you know the initial conditions, right, you can forecast everything. So that's kind of that's the assumption that we're making. So there's no uncertainty about the number of A and I that are out there, but you're exactly right. I mean, we thought about kind of one version where you can, if you imagine that we kind of know death rates, then like once you start seeing deaths, then you can kind of infer what I was, 2 weeks ago, which then if everything's deterministic, you could figure it out.
Yeah.
I'm not saying that that's like everyone is that sophisticated, but you're right that kind of from the initial conditions, everyone is in agreement about what the total, everyone can forecast what the of A and I is going to be, so that they're not responding to reported cases. If they could be responding to reported cases if they understood the underreporting and that asymptomatic people don't always show up, so that could be in there. But it's true that you kind of need to know the total number of people and the activity out there, which is I agree with you that it's a strong assumption that we make here.
Yeah, no, it's interesting. The other thing, I had a small technical question. So I thought it was okay. So the estimation bit was nice. So I was wondering about suppose you have, instead of having just measurement error, suppose you have reporting lags instead. Would that do you have any idea whether the maximum likelihood estimator is sensitive to that? Because I think it's quite realistic to assume that there are reporting lags, especially in the number of deaths.
Doug or Mark, do you want to jump in and?
I could jump in, I guess. So we have done some experimenting with different error structures, having a case like an infected state and then like a reported state, and like transitioning between those, which would induce stochastic reporting lags. We looked at that and it didn't seem to add much when we tried. I think I have seen in some purely epidemiological models they just put in a fixed reporting lag that you would just like a non-stochastic one. That might actually be appropriate in a setting like this. So that's something we're definitely entertaining though.
I mean that's I guess is part of the weekend effect for the number of deaths is reporting lags. No.
Yeah, I mean,
it's somewhat
just to add, if I could just add something real quick. I mean, at the end of the day, right, the deaths happen with like a significant lag in the model, even you know, even after agents become infected and whatever. And so basically that's a sufficiently sluggish process that it doesn't have a very big effect on estimating the parameters that are dominating the sort of short run dynamics in the model about agent activity and whatever. So I think that's part of the reason why when we have tried to play around with that a little bit, it didn't end up mattering very much.
I see.
Yeah. I think Morten, also just to add, like, we're not kind of taking the recovery rate, and we're not taking the recovery rate from like medical studies that say you recover in 14 days. So in some sense, like the kind of the longer it, the slower the recovery rate, we endogenously get that that would almost like this could be kind of biased in terms of the recovery rate to kind of pick up what the lag in reporting is. So I mean, I guess the delta and kappa together kind of would pin down the right fraction of people that die, but kind of the breakdown between the delta and kappa could essentially be picking up the reporting delay. I think so that's part of why I think maybe we didn't find as much of an effect.
Okay, thanks. So good. I have one more question on this slow burn pseudo-steady state. So the one question is more like on the model side, so how sensitive is that to parameters? So could have been possible that you estimate that model and it would give you like a, an exponential growth like in a couple of weeks and not this, couple of years slow burn, or is it basically, very robust to a lot of different, parameter estimates? And then the second question is, so what's the empirical evidence for that slow burn? Because you mentioned other countries, but then, for example, when I look at Europe and, for example, at Germany, other countries, so basically, the RE has been around 1 now for a long time, but there's been a lot of, test and tracing and so there's always local outbreaks, but then the authorities step in and they do lockdowns and they take care of this basically, and it's not all behavioral, and in your model, basically, you say it's all behavioral. And it could well be the case that in the US there will be exponential growth, not just in June, but there will be a couple of weeks of like in the standard model. So these two sides, the data part, uncertainty there, and then in the model, like how big is that region?
Well, just from the model part, I mean, I think like this slide kind of tells it all. I mean, this is in the simple model, so it's obviously it's slightly more complicated when we add in the other features, but essentially, the slow burn is just pinned down by the beta, so how infectious it is and how much you value life. So, to the extent that, so it is very sensitive to that. Obviously, if you don't really care about, the lower it is psi, so the less you care about kind of the kind of death, then the much closer you will be to the exponential regime. And, again, if it's not very infectious, then you get kind of the exponential growth, but again, it's a much more muted because it's not a very infectious. Herd immunity threshold is much lower, so it kind of it diffuses out quickly. So it's really in the basic model, which even kind of extends to the other model. It really kind of is just pinned down by the estimation of these two parameters. So I think everyone's willing to believe that people are afraid of dying, so that this number is big. But kind of like what we've said, I mean, whether how much of that, how that could also be maybe reflecting altruistic behavior, maybe if we're picking up that, then that, we would kind of estimate a slow burn than if it was kind of purely just your your individual trade-off that you're using to estimate in terms of going out.
And then just question you, when you estimate that, you just estimate that, being constant over time, right? At the beginning, you might be afraid there's a new disease, nobody knows about it, but now I know it's only the retired people who die. And so, I might be willing to go out and risk. So is that changing in your estimation over time or no? Or could you check like across different counties with different age structures, whether that's different?
Yeah, so that was kind of Laura's question. So we have the data to correlate psi with other things. We have toyed with the idea of a time-varying psi. I forget if in this version we have it or not, but you're right that that's something that we could easily put in. That at the beginning you kind of are very afraid because you don't know, and that then you kind of learn over time that that's in there. So that could be very well something that you could help kind of explain the patterns in the data. In terms of the linear regimes, I mean, I agree with you that, it's hard. Like I've kind of made a loose statement saying, we see this evidence across other countries. I mean, I guess in Sweden, things also look pretty linear, and I would say Sweden is pretty laissez-faire in terms of what its policy has been. So that's kind of another, I guess, the two data points that I'm most familiar with. But I agree with you that, like, to the extent that test and tracing and other like adaptive kind of local lockdowns are going in, that that is kind of more approximating like what we were thinking about with this eradication zone optimal policy. How much of that is contributing to the, things being linear as opposed to just people being on their own? I mean, I guess we'd have to estimate the model on those different places to know.
Okay, thanks. Morten is raising his hand again. Okay, so Morten, you can go again.
No, yeah, I was just wondering about one thing. So I think it's very nice you allow for a bit of heterogeneity across counties, but in a way you could also allow for something within counties, because that potentially is something that's quite important.
So I mean, that's something. So the next thing I think we would like to do is kind of to put in basically two risk groups in terms of kind of the population, to kind of like to explicitly model the high risk and low risk people. And to kind of, I mean, we from the safe, there's other SafeGraph data that we can kind of like, we can look down to the census block level, which we can then correlate to age and other health things. So, what's true though also is that for like a lot of counties, these things are relatively small. I mean, obviously there's a lot of heterogeneity in, a place like New York City, and a county that has, I don't know, 1,000 people, maybe. I guess maybe there's, I don't know how much heterogeneity there is, but I think you're right that the kind of one area to go is to kind of put in kind of high risk versus low risk.
Yeah.
High risk could be age and comorbidity, and see how that has affected. I mean, one thing that we're slightly worried about is that because these are smartphones, we're like, the data is very representative in terms of like income, education. We're a little bit nervous about how representative it is of old people. I mean, certainly it's probably not representative of people in nursing homes, or like they're not going anywhere, but I mean, they, I guess people are coming to them, which is something that we can also, I mean, nursing homes are in the data, so that we can look at. But there is a slight concern about, is the activity able to pick up a lot of kind of at least the elderly high risk.
Yeah, very good.
So.
Okay, thanks.
Yeah, just to add, we also have, we have a notion of unconcerned people, which kind of gets a little bit at the micro heterogeneity within county. But what it doesn't have is that those people are also potentially lower risk, right? So it'd be kind of like a combination of psi and beta, but so we have something kind of going in that direction, but not quite 100% there.
Okay, thanks. So now there's a question from the floor from Andy Glover. Andy, so can you unmute yourself? So Kurt, I'm actually not a co-host. I think you have to.
Oh, sorry, I didn't make anyone co-host. Sorry about that.
I cannot let people talk. That's why nobody's asking. Raising hands. Okay, here we go. Now I can unmute them.
Very clever to
Very
avoid
good.
questions.
Yeah.
I mean, the other source of heterogeneity that I had asked about in the Q&A would be the people with essential jobs. So like older people, the risk factor might make their behavior different, But then people who are working in essential sectors, I mean, if you look at like the meat packing employees, they just face different constraints on that behavior. So that I would think that would be the other source of heterogeneity across counties and even within people in a county that could affect some of the inference on things like the disutility of getting sick.
Yeah, so I think to get at that, originally we didn't have good ways of potentially measuring people, like all kinds of people going to work. They were outside of home base. Now in the SafeGraph data, kind of for all the POIs, they include the workers. So before they'd stripped out workers, so there's only kind of people that show up like as customers. So, you know, we might be able to kind of look at, again, kind of add in this activity of people going to work, which was kind of explicitly removed to begin with, so that, you know, some of that we may, you know, we may have kind of a mismeasure of activity because it's more just like the consumer side of activity as opposed to like an economic need is really being like having to go to work to do that. So that's something that we could look at with kind of the new version of the data that they've released.
Great. So for the audience, last time to ask a question. So please raise your hand if you have a question. Otherwise, I would call it a day. So this was, you know, the second to last VMACS for this season. Next week on Tuesday, we have Ricardo Caballero and Alp Simsek doing the last VMACS, and then the VMACS Junior will take over and also have bi-weekly seminars. And this is now posted on the homepage, and they will also inform you via email. All going to be via the usual channels. So Kurt and Doug and Mark, thank you very much for being here and for the great presentation. Have a good day.
Thanks, everyone.
Thank you.